Well, it's time for us to talk health. Now today, on the health segment, we're going to be talking about tonsillitis, something that plagues everybody now and again, and I'm not sure if there's anybody who has never experienced tonsillitis before. What causes it? How do we deal with it? Can we get rid of it forever? All these questions that we're asking. 0550-585832 is the number to send WhatsApp messages. If you have any questions regarding this, the hashtag is Breakfast Daily. And my guest is Dr. Kelvin Owusu, who is the MD for Optimal Care Diagnostics, and he's here to help answer all our questions. Good morning, Doc.
Good morning, David.
How are you?
Very well.
It looks as if somebody released a memo and both of us got the memo.
No, say you are the grandpa, so I need to follow that. I need to be like you.
Wow. Oh, wow. Apioko has infected you. How are you doing?
Very well, very
fantastic,
well. Very
fantastic.
Very well.
So, let's jump right into the conversation. So, tonsillitis.
Mm-hmm.
Now, back when I was a teenager,
mm-hmm.
I had tonsillitis like every few months. It was crazy. To the point where people said, oh, go and get your tonsils removed. I mean, it's that easy. Just get your tonsils removed.
Really?
And my parents have this mantra, no knives.
Okay.
No. I mean, if it's on the pain of death, okay, maybe fine, you think about it. But otherwise, no knife.
Okay.
So
interesting.
Surgery was not a conversation that we had in our house, you know. But yeah, so talk to us about tonsillitis. What is it, first of all? And what causes it?
Well, let me just say that both views are quite extreme. I mean, remove the tonsils, you know, it's that easy. Well, it's not that easy.
Okay.
And then no knives. Well, anyway, we'll get there eventually. But the tonsils are actually, it's a group of three lumps of tissue.
Okay.
We have the Palatine Tonsils, which is the most common one that when you say tonsils, most people are referring to the Palatine Tonsils. And you find that at the back of the throat.
Okay.
You know, you should, when you actually open your mouth wide, you see it hiding in the back there. That's if you know what you're looking for.
When you do that, when the doctor says do
yes, so usually
then you see
them
there.
hiding
Okay.
at the back of the throat.
Okay.
We also have the lingual tonsils, which are found somewhere in the buccal cavity, and then we have the adenoids. The adenoids are high up in the throat over there. But like I said, if you mention tonsils, most of the time we are referring to the Palatine tonsils.
Okay.
Now, the tonsils are it's kind of like a sample. How do I describe it? It takes a sample of what's going on around the mouth, in fact, around the atmosphere. So when you look at the structure of the tonsil, it has some depressions and it has some elevations. The depressions are called crypts.
Okay.
You know, and inside these crypts are bacteria.
Okay.
And some viruses as well. So they live there basically,
Okay.
you know, and then in the elevations you have lymphoid tissue. Lymphoid tissue refers to immune tissue. So white blood cells, different kinds of white blood cells live there. Now the idea, or it is believed that the tonsils sample the bacteria that are being brought into your mouth area, you know, into your airway. Now, you know, there's a close relationship between your ear, your nose, and your throat. Okay. You know, so the tonsils sort of sample what is coming in and then sort of preps the body to fight if there's a need to fight.
Oh, wow.
You know, so it's part of the immune system. It's part of the immune tissue that sensitizes the body to prepare or anticipate an attack, so that then it is ready to deal with whatever is going on. So that's basically the role of the tonsils.
Okay.
You know, so it preempts an attack. It preempts a bacterial or viral attack, so that the body is sort of ready to deal with it. You know, so that's basically what it does.
Okay, so I have this picture in my mind when you're describing crypts and elevations. So I'm seeing like mountains and valleys.
Yes.
And I'm seeing the antelope that are playing around in the valleys, and then the mountain cats that are roaming around on top of the mountain tops, and so on and so forth. So basically, the bacteria and the viruses are hidden. Because of course, that's what crypt means. It's like a hidden place.
Yes, exactly.
So they are in there, and then you have the defenses, the soldiers, monitoring on the mountain.
So as you take in air or as you take in food, the tonsil sort of grabs samples of what kind of bacteria is in the food that is coming. Let me sample it and see what is there anything new that I'm not familiar with.
Used to,
and this analogy also makes gives us makes us understand why the tonsils are more active in early part of life. Usually by 0 to 6 years, it's very active, and so it's more obvious when your kid, if you know what you're looking for, when your child actually opens their mouth, you can actually see the tonsils are big. Because everything in that age is new. The child is born, has never had any contact with any of these bacteria, any of these, or let's call it germs. Let's call them germs. They haven't had any exposure to these germs. And so once the child starts interacting with the atmosphere, starts eating, starts playing, starts taking in air, then the tonsils become active because they are picking up so many different bacteria, so many different germs in general, and so they are very, very active. And at that point they are hyperplastic. So very, very big. So generally speaking, almost all children have bigger tonsils than adults. After 6 till about 12, it starts regressing. Most of the time, by 12 years, after 12 years, you hardly see the tonsils. So they regress and they sort of lose their function because now your body is used to all the possible germs that are around your area. So that's actually why the tonsils are very, very, very important in the early part of life.
Now tonsillitis is known as of course, everything that has an itis at the end is an inflammation.
It's an
so
inflammatory
tonsillitis presupposes that it's an inflammation of the tonsils. What will cause the tonsils to become inflamed?
Well, as the tonsils are going through their normal function of sampling the bacteria, sometimes they can get overwhelmed. Or in trying to deal with the new bacteria that has been found, the immune tissue would want to increase in number to deal with whatever the invading organism is, and that process is what is all part of the inflammatory process. Because there's increased blood flow, and it's the blood that will bring the new soldiers. So that increased blood flow, the swelling of the tissue to accommodate the new soldiers, all that is part of the inflammatory process. And I have to be careful. I'm an Ashanti, so the L and the R. So as the tonsils enlarge to try and deal with all these bacteria, then we feel the symptoms of the infection. So you have the fever. You have the pain. Sometimes if the tonsils actually become so big, you have difficulty breathing. So the child begins to snore or have noisy breathing, or begins to sound nasal in their speech. Because the tonsils are sitting right there at the entrance into the airway, so they begin to sound nasal. They speak, and they are speaking obonishine, as they say. Then they might even get halitosis, bad smell coming from the mouth and that area, because the tonsils are now obstructing the normal flow of fluids and air. So these are the symptoms of tonsillitis. So you have the pain, and typically most of us will call this pain sore throat. So sore throat can be limited to either one part of the throat, which could be the larynx, the pharynx, but most of the time you have the pharynx and the tonsils being inflamed at the same time. So but obviously we cannot distinguish between the pharynx and the tonsils, so we just call it sore throat. So the layman will call it sore throat. When you come in and we examine, you realize that is the tonsils that are actually inflamed, and then appropriate intervention to be taken. So the symptoms, and just to repeat, would be pain, would be fever, general malaise, tiredness, weakness, difficulty, loss of appetite, difficulty breathing if the tonsils are very big, halitosis, that's bad odor from the mouth if the tonsils are again very big, and then nasal speech. These are some of the typical symptoms of tonsillitis that we come across. Now, in the very young, they will obviously not tell you that they have sore throat. They will not tell you that they are not feeling well. But what you notice is that the child avoids eating. So difficulty feeding that child becomes irritable. Maybe if you're observant, the child is crying and you look in the mouth, you notice the redness in that area. That should draw your attention to the fact that it's possible that child is going through an acute tonsillitis.
Now, what would be your typical approach to deal with it?
So interestingly, most cases of tonsillitis are self-limiting because the number one cause of tonsillitis is actually viral. It's a viral infection.
Okay.
And as it is with all viral infections, the body deals with it by itself. You don't really need to do anything about it except to give symptomatic relief.
Okay.
And symptomatic relief means that you are going, if there is fever, if the temperature is high, you give some paracetamol to bring down the pain, and also paracetamol to bring down the fever, and also deal with the pain as well. So the treatment is mostly supportive. So they come in, if the temperature is extremely high, you may admit them and give them, tepid sponging and all those things that mothers are quite good at doing. If the child is refusing to eat, we might have to give them an IV to sort of sustain them while the inflammation goes down to allow them to now eat normally. But obviously there must be another side, which is that there are bacteria that also cause tonsillitis. And if it is indeed a bacterial infection, then it's not going to be self-limiting. You would want to intervene by giving antibiotics. Now, the challenge with tonsillitis is that it's difficult to know exactly what is causing. Yes, because it samples everything that goes through the mouth and through the nose. You literally find everything there. So if you were to take a swab and then test it in the lab, you might culture so many different bacteria that it becomes like you can't do anything about it because you can't go chasing each of them. And so basically you need to use clinical experience. You examine the person, you open the mouth, look in there. If you find exudates, pus on the tonsils, it gives you an idea that this is bacterial.
It's a bacterial infection.
If you don't find that, then you are more inclined to think this is viral. But of course it's still not absolute. Now you go ahead and do some lab investigation. So a full blood count. If you were to find now I'm going a bit technical, but it is what it is. If you were to find neutrophils are the particular white cells that deal with bacteria. Then it gives you an indication that this is bacterial. So let me go antibiotics. If you were to find lymphocytosis, then you know that this could be viral. So basically, what I'm trying to get at is that you can't just sit in the house and then determine that
which one
I need to take antibiotics for this thing or not. Because in some cases, and let me just give this warning. In children, antibiotics can cause a lot of damage. Number one, diarrhea. Antibiotics can cause diarrhea in children, and we know already that under 5 mortality is high. One of the leading causes of under 5 mortality is diarrhea. So when you give your child antibiotics that is not prescribed or that is not right for him or her, you could be precipitating diarrhea and you could actually cause morbidity and mortality when it was totally unnecessary. So you really need to report to hospital and get appropriate investigations and examinations done so that we can come to the conclusion that this is a bacterial tonsillitis and then treat appropriately, or this is not a bacterial tonsillitis and then treat supportively. It is very, very important. Now, you did mention surgery, so let me just touch on that quickly. First of all, no doctor, no ENT surgeon takes the tonsils for granted, because the tonsils play a very, very, very important role in early life. And so nobody's in a hurry to go and remove your tonsils. And so before any doctor would suggest or even recommend that we should do a tonsillectomy, there's a strict criteria that needs to be followed. We need to understand that is this tonsillitis, is this patient fit for that tonsillectomy? Because not only is the surgery itself complicated, but because of the very important role the tonsils play, we don't want to interfere with that role if we can avoid it. Then the technical aspect of the surgery. The tonsil is a very, very highly vascular area. You see, because yes, it has as many as 5 different blood vessels supplying the area. And so it's an area that you don't just want to go and do anything there if you can avoid it. And so the role of the tonsils is very important. The technical aspect of removing the tonsils very, very difficult. So we don't take that decision lightly. But there's a criteria. So for instance, somebody who has had recurrent acute tonsillitis. And when we say recurrent, we mean that you've had at least 6 episodes of tonsillitis within a year. And when I say episode, what we mean is that you had tonsillitis, it's completely resolved. Not that you had tonsillitis and the pain and the sensation was still there, and then there was a spike again. No, complete resolution of the tonsillitis. Then it happens again and again and again. If you're having 6 or more episodes in a year, then you are definitely a candidate for tonsillectomy. And I'm stressing on the resolution because there's another category of tonsillitis called chronic tonsillitis.
Oh, wow.
So I mentioned three. There's acute tonsillitis, there's recurrent tonsillitis, and then there's chronic tonsillitis.
Okay.
Now, chronic tonsillitis is where the symptoms, so you've had tonsillitis for about 3 months or more. The symptoms do not resolve.
Okay.
It's persistently there. You understand?
Yeah.
And so this clarification needs to be made because there are different causative organisms or germs, you know, that would require different levels of expertise, different levels of management, you know, so that you don't go and give the treatment for acute tonsillitis to a recurrent and all of that, you know. But surgery, I'm just, because he said that it's easy, and I've heard that several times, but tonsillectomy is not an easy procedure.
Okay.
It is doable, it is done. But we make sure that we do it for the right person at the right time so that we don't lose the important role the tonsils play. Very, very important.
Wow, wow. All right, so just to wrap up the conversation, if somebody has tonsillitis, it's identified that they have tonsillitis. It's a doctor that will diagnose it, right? You can't just sit at home and say, oh, I feel pain, and so it must be my tonsils. Let me go and get some antibiotics. That's not the way to do it.
True.
Okay. Now, once it's been diagnosed, at what point, so if the doctor suggests surgery, do you just go ahead and do it, or?
Well, I mean,
you ride out the storm.
So like I said, there's a criteria. If you are having multiple episodes of acute tonsillitis within a year, then we need to intervene.
Okay.
And one of the modes of intervention would be a tonsillectomy. You know, because assuming that this kid is in school and is missing school a week, 2 weeks for 6 different times. I mean, that's quite disruptive.
I mean, I would use myself as an example. So I think that there were probably a couple of years that I would have tonsillitis that often, you know, and so it was suggested. But again, I mean, I'm here now. I've not had tonsillitis in a long time.
Yes.
You know, so what is it that then takes you past that point?
Well, remember I mentioned that the tonsils are active in early life.
Yes.
So as you grow older, the role they play regresses.
Okay.
So at some point, I mean, the particular point varies from person to person, but we know that after the age of 12, you will not usually find people having tonsil issues. It doesn't mean that adults don't have tonsillitis.
Yeah.
It just means that it will not happen as often as it used to happen.
Okay.
But again, if you are having tonsillitis recurrent episode even as an adult, obviously needs intervention because it could predispose to other things. You see, because if you are if you are struggling to breathe, for instance, if you are snoring as a result of tonsillar enlargement, swollen, it could lead to other things.
Yeah.
You know, and so we don't want the complication. So any form of tonsillitis that is complicated by other complication means other things are happening, would be a subject for medical or surgical intervention.
Okay.
And so it's important you go have a proper examination done by an ENT, ear, nose, and throat specialist, and then they will make the call, and then we take it from there.
All right, super. Dr. Kelvin, people want to reach you. How do they reach you?
Well, I'm active on social media, Kelvin Owusu MD, on all social media channels, so you can link up.
Super. All right, so link up with Dr. Kelvin Owusu, the funkiest doctor alive, right? Yeah, he's the MD for Optimal Care Diagnostics, and like he said, you can reach him on social media, all social media platforms as Dr. What is this? Nasa Epoku. Is it Nasa Epoku?
Kelvin Owusu MD.
Kelvin Owusu MD. We still have you as Nasa Epoku on IG.
I know, right?
Yeah, right.
But Kelvin Owusu will still get you.
Kelvin Owusu will still get me. Okay, fantastic. So Kelvin Owusu MD.